Hello, my name is Kenyetta Brummitt. I'm an obstetrician and gynecologist. My focus is mainly on the reproductive health of young adolescent women and older women.
I'm an obstetrician and gynecologist. That means that I provide obstetrical and gynecological care, and I like minimally invasive surgery.
I finished residency in 2004. I've been practicing since then.
I've been practicing for 16 years now.
Yes, since the age of 4, I've always known I wanted to be a doctor.
My father is an OBGYN, my sister's an OBGYN, and I'm an OBGYN. It's kind of something that was just in the household. You got exposed to it and you kind of gravitated towards it.
Originally, I thought I wanted to be a surgeon. However, during my clinic rotation, I just loved interacting and bonding with the expectant moms. Mississippi has a large underserved population, and it's different working in a place where you are needed and wanted, and we feel appreciated here.
And we plan to be here for 3 years only, and Mississippi just kind of sucked us in.
What I love most about being a physician are 2 things. First is interacting with patients, and second is I've always loved puzzles and mysteries. So it's like they come to me with a mystery or a problem and I get a chance to solve it or fix their problem.
I like helping people. Unlike so many things in medicine, in OBGYN, you are taking on a task, whether it be a pregnancy or irregular bleeding, and you can tackle it, you can fix it, and you can have a happy ending. And I kind of like that. I think that's one of the reasons that I'm drawn to this field.
What I do mainly for fun is hang out with my family. I became a mother at 43, also cooking and traveling.
I'm supposed to run for fun. I haven't been doing so well lately, but generally I run. I love movies, I like books, and I really hang out with my 7-year-old, and that takes up a lot of time and spends a lot of energy.
So in this day and time, a lot of us females prefer a female physician because we feel like, we listen more. Of course, we understand where they're coming from, but he actually does listen and does take into account what a patient wants and what their needs are.
I think that people will be surprised to know that my wife is a super sci-fi junkie nerd. She loves all of the big shows. We actually own all of the Lord of the Rings stuff. She's seen and read all of the Harry Potter series. She eats it up. She's the first one to see it.
The reason I decided to start a practice with my husband is since residency, we've always worked together off and on. When we moved to Mississippi, our first employer employed us together. And so it's just worked out. We thought that maybe we'd have an issue with work-life balance, and it actually has made it stronger, made it better. So we've just enjoyed working together. So he's not afraid to tell me if I'm wrong, if I need to do something different, and he's always there for support as well.
She's super smart. I can bounce anything off of her. She always has a great answer. She's just super smart. She's a great colleague to have, and she just makes me stronger.
The biggest challenge with working with my husband is when we have difference of opinions, but we both learn that sometimes there's more than one way to manage a patient.
She's super stubborn. We argue and bicker a little bit, during work, and but she's usually almost always right, and that's hard to accept sometimes, but it helps me.
The second biggest challenge is separating home and work, but we've established boundaries and some rules that have helped that to not be such a problem. Being an OBGYN, sometimes you spend a lot of time away from home, and so at least that other person knows what you're experiencing and what you're going through and what you may need. And so actually it's just made it stronger.
It used to bother us a little bit at home, but we kind of came to an understanding. We can fight like tigers at work, and when we get home, we don't discuss medicine at all. And we're also super busy because we're old people with a 7-year-old. So there's really no time.
What I admire most about my husband is his attention to detail. He is a stickler for getting it right the first time.
She's super smart. She's super dedicated. She's super diligent. She's the ideal physician. Like when you think about what a doctor is, it's her.